my name is Rowena Tam, and I am a physical therapist. I am also a certified lymphedema therapist. I got my DPT from San Diego State's Doctor of Physical Therapy program, and I practiced for about 3 years in outpatient pelvic floor setting. And then now I'm currently in my PhD program. It's a joint program through San Diego State and UCSD, which is the University of California, San Diego. And I am majoring in public health and health behavior. And my dissertation focus is on pelvic floor dysfunctions among breast cancer survivors. On a perfect day, I absolutely would choose going on a weekend camping trip with my husband and my dog Bubbles and just hiking for miles and being out in nature. So my journey's a little bit different. I actually was a communications and public policy major at UC Berkeley. During that time, I also ran Division I track and cross country. And so I was very much interested in health policy, but it felt a little esoteric and just kind of out of reach at that time. And so in order to kind of blend my physiological interests and also health policy, I found my way into PT. In PT school, I thought, I just want to get this degree. I want to practice. I want to work with people. And once I got out into the field, I started working with patients one-on-one and realized that a lot of them had a lot of undiagnosed pelvic floor dysfunctions, even my ortho patients. So I would just ask them oh, just by chance, any leaking. And the area I worked at was a very high income bracket area. And I was like, if these women don't even know about pelvic floor dysfunctions, what about women who are in lower income areas, don't have access to all of those resources? And so I kind of found my way back into public health and really, trying to broaden access to physical therapy at a population level. So the funding that I received from the Foundation for Physical Therapy has helped immensely. It has given me protected time to really focus on just my dissertation. So I was able to take that time to just write. With that protected time, I'm also able to try and find and secure funding for my postdoc. The Foundation for Physical Therapy Research is absolutely instrumental for early investigators like myself, especially having come from a clinical background. It's really hard to compete against other people who are also coming in as, first year PhD students, but they maybe knew through their master's and undergrad that they wanted to do research. So they have a huge backlog of research experience. The foundation really kind of understands that these are burgeoning, possibly had been clinicians for a while before they decided to go back into a PhD program. And so being able to recognize that, yes, your experience as a clinician is just as important, and we support that. I think in this climate also where we're seeing, maybe some shifts in the way that federal grants are being funded and how institutions are utilizing federal grants, it's going to be even more important for private foundations and beneficiaries to really help support the scientific community. The direction in which I'm hoping to go in and how the funding is going to help with that. It is currently funding me as a candidate in order to finish my PhD, but then also it is helping me to secure ideas of where to go with my postdoc. Specifically, what I'm interested in is health services research, particularly increasing access to physical therapy, because as part of my dissertation, a subset of questions is really asking, where are you getting these referrals for PT? Are you using them? And the biggest barrier that we found was actually physician referrals. Majority, I would say 80% of the people that went to PT first received a referral from their physician. So using health services research to really understand at a population and systems level, how can we implement real world strategies to get more patients into PT earlier on too. I'm hoping my trajectory will eventually be tenure track at a physical therapy institution, hopefully splitting my time between teaching and research, because I have found that teaching is absolutely incredible. It's really neat. Fostering the minds of the future generation, especially the class that I teach is actually research focused. And so it's really neat having these first years come in saying, what's the point of research? I just want to work with people. And then them coming back in a couple of years going, oh my gosh, like this has been instrumental in me being able to practice at the top of my degree, to be able to talk to physicians, to be able to advocate for their patient with an evidence-based practice. In terms of the subject matter, I'm really hoping to kind of go heavily into health services research, because that is one of the biggest barriers that I've seen into patients being able to access and even to know, because a lot of patients still see their physician as their first line of what should I do about this pain, or what should I do about this leaking. And so if we're able to implement interventions that target all of these different levels of systems and providers and patients, then we're going to have a lot more access and utilization of physical therapy. I think if you're interested in research, reach out to your old professors, reach out to me. I love talking about how I got into research. I think the biggest advice that I got from a lot of the mentors before me, who I had asked prior to entering the PhD program, was kind of, figuring out, why do you want to do this? If you're wanting to progress the field on that population level and a wider net, I think at the core base, all of us as PTs really just want to make the world a better place. And doing it through research allows you to reach a whole level of outreach that isn't quite possible on a one-on-one level. I think that my biggest message is to always keep asking, but why? 'Cause that's kind of what got me into research. I kept asking, but why do we do this? Use research to really scratch that mental itch.